Hi there, my name's Akana and I'm a medical student. It's nice to meet you. In your journey with melanoma, you might have heard the staff at the hospital mention the terms MDT or MDM. I plan to explain to you what these mean. You may have seen your doctor talk with other health professionals about your care. We can achieve the best outcomes when a group of experts work together to plan the management of a patient with melanoma. This is where MDT comes in. MDT stands for Multidisciplinary Team. This is the name given to the team of professionals who are from a range of different disciplines or specialties. MDM is short for Multidisciplinary Meeting. This is the meeting where the multidisciplinary team discuss how best to look after their patients. They can share ideas and make sure the patient gets the best care from the most appropriate service. The MDM improves communication between the services and saves valuable time. It's usually a face-to-face meeting, but if urgent, sometimes an MDM is undertaken by telephone or email. Patients discussed at MDMs are those with advanced melanomas or unusual types of melanoma. Patients with advanced melanoma are patients in which the melanoma has spread to the lymph nodes or another organ in the body. We call these stage 3 and 4 melanomas. In patients where this has happened, treatment is usually more complicated. Patients with unusual melanoma include children younger than 18 years old. Melanoma which first forms inside the body, not on the skin, is also uncommon. These are called non-cutaneous melanomas and include ocular melanoma, which is melanoma in the eye. Desmoplastic melanoma is another rare type of melanoma discussed at MDM, as it might need unusual treatment. Now I will introduce you to the professionals who are part of the MDT. All teams will have a melanoma surgeon, usually a general or plastic surgeon. If the melanoma can be removed, they will be the ones to do it. They also remove involved lymph nodes. There will be pathologists, who are doctors who look at the melanoma under the microscope after it has been removed. They can distinguish between the different types of melanoma. A radiologist will be present. They are doctors who look at clinical images, such as X-rays and CT scans. They report if they have found melanoma to have spread to other sites of the body. There are two types of cancer doctors at the MDM. The radiation oncologists treat patients with radiotherapy, and the medical oncologists treat patients who need chemotherapy or targeted therapy for their melanoma. A clinical nurse specialist will be there to explain the results of the MDM. The nurses look after the patient on a daily basis. Sometimes, depending on the situation, there will be other professionals on the team. Dermatologists have often made the initial diagnosis of melanoma. The patient's family doctor or GP is welcome to participate, as they are often the one looking after the patient after they leave hospital. Adolescent or young adult key workers are part of the team when looking after young people. All Māori patients and their whānau have the opportunity to access cultural support services and whānau order assessments. And finally, palliative care team members might be there to discuss pain management and improve the patient's quality of life. So now we know who is at the meeting. What do they do at the meeting? First, details of each patient are discussed. This is recorded on a standard template. Doctors will talk about what kind of melanoma the patient has and the symptoms they are experiencing. They will review and discuss the results of investigations and tests. The pathology and X-ray images are displayed for all team members to see for themselves. They will consider medical or social aspects that might affect treatment or the disease process, such as medications, other medical conditions, or where the patient lives. The team discuss how best to treat each person and how to meet individual needs and preferences. MDMs are usually held in the larger hospitals in New Zealand every week. Smaller hospitals can talk with doctors in the larger centres by teleconferencing or video conference. Sometimes patients are discussed on several occasions. After the meetings, records of what has been discussed are kept in a regional or national database. This allows the recommendations made in the meetings to be accessed by any of the patient's healthcare team. Well, that's all from me. If you have any more questions, remember you can always ask one of your nurses or doctors. They will be happy to help. Kia ora.